Welcome, everyone, to MindViaSol. I am your host, Yvette LaBoy, and on today's show, we have Dr. Masghati, who is an OB/GYN, and she's going to be speaking about menopause. I'm super excited to have her on. It's a topic that I'm very interested in. So welcome, Dr. Masghati. How are you? Thank you for joining us.
I'm super happy to be on. Thank you for having me.
Thank you for being open to letting us interview you. Dr. Masghati, I'm curious. I've noticed that there's an increase in women using estrogen cream on their faces. What type of estrogen creams are considered safe and effective for skincare?
I love that you bring this question up because we are always trying to be mindful about what we put in our bodies and on our bodies. So the products we use want to make sure that they're clean and they're safe. In terms of hormone creams, that's kind of been obviously hyped a lot recently on social media. We actually have known for decades that topical progesterone cream or estradiol cream or estriol cream can have beneficial effects on fine wrinkles in the face and thickening the collagen and making the skin stronger and more resilient and more moisturized. And what I would say about this is make sure whatever product you use has the right concentration for the face, because you don't want to use the cream that you're applying to other places in your arms or your thighs for a systemic estrogen replacement on your face, because that's not the right dose. It's not the right concentration. And then what I often hear women say, well, can't I use the same one that I use for my vagina? Because that's a lower concentration one. And I would say, if it's a compounded cream that doesn't have inactive ingredients, alcohol, fillers in it, maybe, right? If it's the right concentration. But if it's the typical estrase cream or Premarin cream that you get over the counter or from your CVS, not over the counter, but you get it from your prescription through CVS or Walgreens, from your regular pharmacy, be careful. I mean, there's tons of inactive ingredients in there, alcohol, other things that might not be the best thing for your face. So even though the hormone in it might be good, all the other things in that cream might not be so great for you. So if you're going to use those creams, use clean products that don't come with a lot of inactive ingredients.
Okay. Wow. That's good information. Very good information. So can someone use estrogen, like those facial creams? Can it have a systemic effect on someone who has an autoimmune condition such as lupus? And what should women be aware of?
Yes. So they are in lower concentration if they're made the right way for the face. So they wouldn't really raise your systemic levels the same way. So this just the same as the vaginal estrogen that is very lower concentration, 0.01%, instead of 1% or more. So you are basically using a lower concentration one, so the systemic absorption is not as significant, even to the point where we know with vaginal estradiol for patients with breast cancer, it's safe to use because it doesn't raise systemic levels. So with facial creams, they have been shown to not raise systemic levels as much if they're used in the right concentration. I'm not sure. Sorry, they haven't been shown. There's not a lot of studies, but what I'm saying is it's the same concentration, so it's the same assumption that they're not raising your systemic levels as much. So you want to make sure you use the low concentration creams. That's what I'm trying to get to. And if you use estriol, again, for the face or for the vagina, that's a different type of estrogen. It also has to be the lower concentration. For progesterone, the lower concentration. So you want to make sure it's not the same cream you use for your body for systemic use.
Okay, great. Very informative. What would you recommend to women who are interested in doing hormone replacement therapy, HRT? And what are the implications of hormone replacement therapy for women who have heart disease? Should they be on that, or should they look at other forms of therapy for
Yeah.
that?
And should we specifically talk more about women with autoimmune disease and hormones, or just in general?
Just in general. Just
Just
in
in
general.
general.
Mm-hmm.
So I believe that depends on what type of heart disease we're talking about. But
Mm-hmm.
what we know from studies is that estrogen has positive effects on heart disease, such as plaque buildup in the small arteries of the heart vessels that can, lead to heart attacks. Estrogen can decrease that plaque buildup and help us lower the inflammation in the vessels of the heart. So in general, estrogen has positive effects on heart attacks and stroke, and plaque buildup in the vessels, inflammation in the vessels. Estrogen also has positive effects on the muscles of the heart. So it has been shown to decrease the occurrence of congestive heart failure, where the muscle of the heart is failing. It becomes really
Mm-hmm.
wide and dilated, and it can't function as well. Estrogen has been shown in studies to lower the risk for that. So the general benefits of estrogen for heart disease are positive. Estrogen also has positive effects on the heart rate. So if women develop often in perimenopause and menopause, they develop new onset of palpitations, meaning rapid heartbeat or arrhythmia, and estrogen can have positive effects on that. So in general, there can be a lot of positive effects. And then estrogen also increases the release of nitric oxide, which helps the vessels to dilate. So your heart vessels are more dilated, you're less prone to have small vessel contractions, where you're more prone to, again, cardiovascular events and complications with your heart. So overall, estrogen will help you lower your blood pressure, help the blood flow to the vessels, help the heart muscle, help the plaque build up, and help lower your heart rate.
Okay, great. We're going to take a break and we'll be right back. Don't go away.
Hey there, folks. If you're looking for wellness tips, insights, and inspiration, you have to visit our MindViaSol Facebook page. Follow us to stay updated with content, as well as more information and more videos from our amazing host, Yvette LaBoy, and the brilliant Dr. Christine Bashara. They're bringing you the best in holistic and medical wellness information. If you have any questions, please reach out to us at info@mindviasol.org. We're here for you. Now go hit that follow button.
Welcome back to the show. We're having a conversation with Dr. Masghati, and she is sharing her wisdom and knowledge on menopause, which I'm finding so interesting. So, Dr. Masghati, what proactive steps can a woman who's in perimenopause take to prepare for a smoother transition into menopause?
I think the first thing I would do is understanding that you're not going to be able to have the same lifestyle that you had in your 20s, getting away with, all-nighters, partying, maybe the same amount of alcohol, same amount of snacking, same amount of maybe not eating the right foods, right? So things that you can start with is improving your lifestyle, making sure your nutrition is dialed in, you are avoiding junk food, processed sugar, you're getting enough protein, you are getting enough healthy fats and complex starch, the fibers for your gut. You want to make sure that you're not overly drinking alcohol, because your liver is not going to be able to deal with it the same way when you're younger. You want to make sure that you don't skimp on sleep, because having regular sleep regimen becomes more important in perimenopause. You're going to have less resilience of your adrenals to stress and sleep deprivation. So maybe adjusting your lifestyle. For me, it meant I left my very stressful hospital job and long hours of surgeries. And I underwent, hormonal changes, and I had to make changes in my career. It also means that you want to make sure you have the right type of exercise on board, because you are gradually going to be losing muscle mass and bone
Mhm,
mass in
mhm,
your after your 30s, and you
mhm.
want to make sure you maintain that as much as possible. These are all wonderful proactive steps that it doesn't cost you much. You can just do them for your overall health. In addition to that, I would say get your hormones checked so you know where your baseline is, where you're at when you're not having loss of estrogen yet, loss of progesterone yet, and just seeing what your adrenals are doing. Check that out, and thyroid as well, so that you can compare that to when those levels change.
Okay, great advice, great information. Dr. Mascati, so alcohol, does
Mhm.
that play a role on when you're going through menopause? Because I work with clients, most of them are people who have autoimmune conditions. And one of the first things I say to them is that you need to cut back on alcohol. Is that something that you would recommend to your patients as well?
Yes, the reason is a lot of women are drawn to alcohol for some of the sedative effects it has. It can
Mhm.
release GABA, but the problem is it's a toxin if you think about it that way. It has to go through your liver, and your liver suffers a lot as we get older. We are not as good as detoxing things anymore, like really fatty foods, processed sugar. We don't do well as well, and alcohol is part of it, and it puts more taxation on our hormone balance as well. So, and then it can disrupt our circadian rhythm. Alcohol can completely disrupt that, wake us up in the middle of the night. And one of the first signs you don't no longer do well with alcohol is if you drink a glass of wine and you wake up in the middle of the night. That's a sign that your liver is overwhelmed and you're no longer being able to adapt to the demands of, the alcohol that comes with it. Now, if you drink alcohol and you want to enjoy yourself, just do it in moderation and in high quality types of alcohol, and do it in a social setting where you're enjoying yourself with a good meal and friends, and it's once in a while. But if you're drinking at home by yourself because that's what you need to fall asleep, then we have
Mhm.
a problem.
Okay, totally agree. Dr. Mascati, what when a woman is going through menopause and I guess
Mhm,
perimenopause, we start losing collagen and
mhm,
we don't we start not looking the same when we look in the mirror.
mhm.
What is something that you could recommend, whether if there's anything that we can do to kind of rebuild our collagen? Is there certain diets, certain foods or supplements that you would recommend that someone who is going through perimenopause or menopause that they could do to kind of improve that?
Yeah. So as you go through menopause, you lose the ability to break down protein in your stomach, you lose digestive enzymes, and you also can get a change in gut microbiome. So you can get more gut dysbiosis, leaky gut. So now you're going to have more inflammation. You're going to be able less to break down proteins, and then you're losing estrogen as well. And estrogen is the main player for women to maintain collagen and connective tissue. And as you lose estrogen, your skin gets thinner and more less has less blood flow, more pale, more
Mhm.
flat looking, and less moisturized. And you get more wrinkles. You also are more prone to oxidative stress from sun and other stressors, smoking or environmental toxins as your estrogen goes down, because estrogen reduces oxidative stress in the skin. So you have that. So that's a cumulative effect. And then if you have a lifestyle that is not conducive to protecting your skin, like you are exposed to a ton of midday sun, very high intensity sun, and you don't protect your skin, or you are basically, a smoker, you don't have enough antioxidants in your diet, you have inflammation in your gut, all of that is going to make your skin change. And very important to understand that you want to work on your gut, your absorption of the protein, and the composition of your diet. So you have enough protein and collagen products in your diet. And you want to make sure, if you can do it, if it applies to you, you optimize your estrogen levels. And then you reduce things like smoking or alcohol that increase oxidative stress. In terms of sunlight, sunlight has a lot of benefits for us, and it helps regulate our circadian rhythm. It can help vitamin D production. But we're talking about not being exposed to the sun the entire year, and then for the 2 weeks of your vacation, you are in the middle of the day, laying in the sun, drinking alcohol by the pool. That is not the right type of sun exposure you want to do for your skin, because you're going to cause damage. You want to slowly ease into sun exposure. So starting in spring, you want to start exposing your different body parts to the sun so that your body gets adapted to it. You want to maybe start by avoiding the complete, high intensity midday sun as well. And in terms of the skin overall, I don't wear sunscreen on my extremities. On the face, if you want to wear a non-toxic zinc oxide sunscreen on your face for the wrinkles, you can. But I like to have some sun go through my skin for the vitamin D effect. But I don't do it suddenly out of nowhere in the middle of the day with the highest intensity. I live in Florida and there's a lot of sunlight, so you're definitely more prone to hyperpigmentation of your skin and wrinkles from that.
Great. We're going to
another-
take a break right now. I'm sorry to cut you off, but we need to take a break, and we'll be right back, and we will continue this conversation.
We know the pressure you feel.
They say there are no excuses.
They say to just push hard.
They say to just go faster.
But when we're on the field, they don't know what's going on inside us.
How hard is too hard?
When do we get support?
When do we raise our hand and ask for help?
How are we supposed to feel good in here when that's happening out there?
We need each other.
Love, your mind.
We are back with Dr. Masghati, and we're going to continue the conversation. Dr. Masghati, what we were speaking about, can you please continue? It was so interesting. I'm learning so much.
Yes. So, of course, for your skin, hydration is important, internal hydration. So you don't want to overdo things that dehydrate your skin and that are too acidic. So in terms of coffee, like if you're just drinking coffee, but you're not hydrating with minerals and water, that's going to dehydrate your skin as well. There is more herbal teas or mineralized water that might be more beneficial for skin hydration than just drinking coffee. In addition to that, the water that externally meets your skin is also important. So you want to make sure that you're filtering chlorine and fluoride out of your shower water. That's what I wanted to add for the skin as well.
Okay, great. Great information. You mentioned herbal teas. Is there a specific herbal tea that you would recommend over another?
I believe that high vitamin C containing teas are beneficial for collagen and skin. So that would be like rosehip tea or
Wonderful.
the other one that it's escaping my mind. It's with red berries. Like I forgot it, but there's some teas that hibiscus tea. Oh my God, I just came back. So hibiscus tea and rosehip tea can be beneficial for vitamin C.
Oh, great, great. And I have both of those here at home with me.
Nice.
So I would like to speak a little bit about autoimmune conditions, like, for example, lupus. When it comes to hormone therapy for women with autoimmune conditions, what specific considerations should be made when recommending HRT? And are there anything specific that they should be doing because they have an autoimmune condition? And can a person who's been in remission from lupus, if they're going through menopause, is there a possibility that they may get a flare?
Yes, these are wonderful questions. I believe that if someone is in remission and under control, they should absolutely consider HRT because they can have a lot of benefits from the hormones for all their organ systems, their brain, the bone, their heart, their skin, their mood and gut, and a lot of things, because we have receptors for hormones in every organ tissue, not just our uterus. But when you have lupus or systemic sclerosis or scleroderma, these three entities are a little bit different than rheumatoid arthritis or multiple sclerosis or other autoimmune diseases. And
Yes.
it could be that they're a little bit driven by different immune cells, and they might be because there is the autoantibodies involved in those. And
Yeah.
but you don't only just have the T cells, but also the B cells involved with the autoantibodies. What those autoantibodies are is that the body is attacking its own tissue with the antibodies, and then there is some sort of dysregulation with the T regulatory cells. These are the type of immune cells that can also basically attack our own body if they're misinformed. It's like your soldiers are being given the wrong information and they're attacking the wrong enemy, like they're attacking your body. And what I say about this is that there is some data from some studies. None of them were randomized, controlled, and none of them were using the type of hormones I use, by the way. I use bioidentical, and I don't use oral estrogen. I don't use conjugated estrogen. That's a big one. But even with that, there was some studies that showed if someone is going to have a flare-up with their lupus, those are going to be more mild flare-ups instead of very severe flare-ups. I thought that information was interesting. There's some information that if you have a predisposition to lupus, like a genetic history, because I believe there's a family or genetic involvement in these diseases as well, which makes you more prone to developing them. So if you have that family history, you don't have lupus yet, and you are starting HRT, I would probably monitor ANA and some markers for inflammation in your body. And I would obviously monitor for symptoms. There's some information that you might be a little bit more prone to developing lupus then. But the question is that because of the type of hormones those studies were looking at? Because those studies were not randomizing it, and they were not looking at exactly what other factors were playing a role. But we know hormones can play a role in the development of lupus. We know that women can have more flare-up when they have pregnancies going on, right? There is some data that if you start oral birth control and you develop lupus or have lupus flare-ups mildly increased. So I'm thinking we need better data with the right type of hormones, right? Not synthetic, not oral, but dermal. And even in that, I believe that some data we have, it wasn't that alarming to me. Like it was mild flare-ups, but not severe flare-ups. So the question is the benefit of it outweighing the risk for those patients? And is this something where we have to individualize? So let's say I do hormones for you. You have just a mild flare-up and we can get it under control. Is it worth it with all the other benefits versus you get a severe flare-up and we can't get it under control? Should we then discontinue the estradiol portion of that? You still might be a candidate for testosterone or progesterone. So it's a complicated question. I would definitely monitor markers, symptoms, and just be more aware of my patients with autoimmune than the regular menopausal patients. However, let me just say one thing. Estrogen is immune suppressive. So having enough estrogen on board actually reduces the risk of developing generally autoimmune diseases in women. So there is a lot more to this discussion, and the type of estrogen definitely matters. You don't want to use oral estrogen. Yes.
Great. Thank you for sharing that. We're going to take another break and we'll be right back.
We come from a long line of farmers, and there's a sense of pride, but there's also a significant amount of pressure.
Farmers have to take care of their physical and their mental health, because what's a farm without a farmer?
Watching the sun come up, that's my time. I can have a cup of coffee, and every day is a new opportunity.
That's cool. Your hand's gotten so yeah.
Don't forget to check in on yourself. Love your mind.
Welcome back. We're back here with Dr. Masghati. Dr. Masghati, what key advice on menopause? If you could share one crucial piece of advice with women about menopause, what would it be?
I would say that don't be scared. Every woman is going to undergo menopause. Find your tribe so that you don't feel alone in it and you have women to commiserate with, and inform yourself. And find yourself a physician, a provider that you can trust so that they can guide you and follow you through this process and advise you best. And having a health coach and a coaching program on board can be so helpful with this transition. So just know that you're not alone. Every woman has to go through this, and there's a lot more options and solutions out there to your problems. It's just a matter of finding the right person.
Great. Thank you for sharing that. What I would like to do is, folks who are out there watching the show right now, especially my women who are out there experiencing perimenopause and menopause, if there are additional questions that you would like us to ask Dr. Masghati, please email us on the email address below and let us know what those questions are, because I would love to have Dr. Masghati come back and share more of her knowledge, more of her wisdom on menopause, because I feel that this is a very important topic for women. I know it is for me, and I see on social media so many women asking questions about this that they just don't know. And they find it very challenging. So email us on the email link below, and we'll get Dr. Masghati back for another interview. I, for one, would love to do a live with you and have you come back into the studio and have a more in-depth conversation on menopause. How do you feel about that?
That sounds lovely.
Wonderful. So, Dr. Masghati, if someone wants to get in touch with you, how can they get in touch with you? Where do they follow you, on Instagram or Facebook or any of the social media handles? Can you share that, please?
I think my Instagram is an easy one, drsalmamasghati.md.com. Sorry, Dr. Salma Masghati MD on Instagram. And then my website is drsalmamasghati.com. On my Instagram, I try to share a lot of educational videos and content that can help women inform themselves better about their options.
I've seen them, I've listened to them, and I've learned so much from you. So folks, I definitely highly recommend that you log into her Instagram and watch her videos. She shares a wealth of information on menopause. She even spoke on the topic of lupus one time, which I found super interesting, and I learned a lot from it. So is there any last thoughts you want to share before we leave? Because we have a couple of minutes before we have to end the show, Dr. Masghati.
Well, I just wanted to say I love what you do and how you're trying to help women with lupus. And I think that it would be great to maybe we can dive into this next time. But why is it that the incidence of lupus has more than doubled over the last few decades? What else is contributing to this? Why are we having more autoimmune diseases than ever? What is happening to our bodies, and what's our environment contributing to that? And having women like you out there that are just really helping this group of women that are going through this, especially because it's so much misdiagnosis out there. Lupus is mostly a clinical diagnosis. It's really hard. I think it's great what you're doing. So I really admire you for that. And there's probably a lot of topics we could dive into next time. I'm looking forward to that.
Sounds great. And I look forward to that as well. That's a topic I love talking about. Folks, we are ending the show today. Thank you, Dr. Masghati, for coming and giving us some of your time. I greatly appreciate it, and I'm sure our viewers appreciate it too. Folks, thank you for watching the show, and we'll be back next month with a new show. Bye.